joy and pride to welcome each and every one of you to this special occasion, the inaugural function for our postgraduate students. A moment that marks not just a new academic journey, but also a new chapter in the growth of our institution. For the first time ever, Trichy SRM Medical College Hospital and Research Center has crossed a remarkable milestone with over 106 postgraduate students joining us in this batch of 2024-25. Let us take a moment to celebrate this incredible achievement with a big round of applause. And with this momentum, we are sincerely hoping and working towards welcoming even more PG students in the years to come. Before we proceed with today's inaugural ceremony, let us stand together to offer our respect through Tamil Taivarthu.
சீராரும் வதனமென திகழ்வரத கண்டமிதில் தெக்கணமும் மது சிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறை முதலும் தரித்தனலும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் வணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம் வியந்து செயல்மறந்து வாழ்ந்ததுமே வாழ்ந்ததுமே வாழ்ந்ததுமே.
Thank you. We would now like to invite our beloved Dean, Dr. Gopakumaran Kartha sir, to deliver the welcome address.
A very good morning to one and all. Respected Chairman, Dr. Shivakumar sir, Chief Director Sethuraman sir, Director of Research Kartha, Kamala sir, and Director Revati ma'am, and Medical Superintendent, and all the respected dignitaries on the dais, heads of the department and faculty members, and my dear postgraduate students belong to 24-25 batch. I know that my official responsibility is to welcome you all. It's only very technical, I should say, because it's our in-course function and we are with you and you are with us mingling in this campus for the last 3 to 4 months. So, because of the official reason, you are actually trickling in starting from November and it went up to March of 2025. So, it's a long process because of so many reasons, multifactorial in that way. But anyway, we are all here to welcome you, have an official induction program for a new academic and career journey ahead of you. Before entering into my official responsibilities, let me tell you one or two important things. It may be very useful for your future life as an elderly person in the medical education. So this is a momentous. I really mean that it's a momentous occasion, an occasion of pride for you and a satisfaction for you. Because you have gained the specialty of your choice. You have selected the stream of medical career according to your choice. And more than that, you have selected one of the pioneer institutes in the country with a great vision of chairman and the top management. Within a very short span of time, if you look from outside, because I joined as a part of this institution only 3 months back, hardly, and my perception, 15 years is too short a period for an institution of our scale to prove the existence, to prove the path of excellence, and we have attained almost everything. I still remember the words of, if I got the words of chairman in my earlier discussions, what he said was very proud and very utmost satisfaction. He said that, Doctor, we have attained everything in academics, if I'm correct, everything in academics. So that confidence brought him to say that we have attained everything. But there are certain areas we should look into to patch up. So that particular word of confidence, I rarely heard from any top stakeholders in my past career. So that particular confidence brought by all the faculty members, the postgraduate students, medical students, and all supporting faculty. So I wish you to maintain that particular charisma in the future also. And as to my dear postgraduate students, so every day every minute is so important for the next 3 years. My humble request is the lot of clinical materials, lot of opportunities, lot of portal for improving your skill and the knowledge is around you. Look at them. Keep your eyes and ears open. Grab every opportunity to learn, to upskill yourself. Please grab it and utilize it. Because the post-graduation is nothing but, it's not a passive learning at all. It is an active learning. You have to be aggressive and you have to be chasing the faculty members to get your knowledge. Because these 3 years period, you have got all freedom to do small minor mistakes, and from the mistakes you can learn. That doesn't mean that you are bound to make mistakes, no. Because vicariously, your senior professors, your senior colleagues, and all faculty members are there to support you. You have that particular immunity. But after 3 years, when you are having a postgraduate degree against your name, my dear, it will be very, very tough to make mistakes in the present scenario. Because all the governing forces, the public, and all other law enforcement agencies are very keen and very critically appraising your act. So try to be confident, gain all the skill. As per Vivekananda says that you can acquire knowledge with all the H domain, he say, with the head, that is the knowledge of the cognitive part, your hand, your dexterity, you develop your skill, and the utmost important to my perception is heart. So you learn things, you respond to the disease, make a safe diagnosis, and take up the therapeutic process with the heart and soul in the way. That completes your journey, that completes as a doctor. I am 100% sure that you all will be coming out with excellent colors after 3 years, and the majority of you will be going into subspecialty. Now they say that it's not super specialty, subspecialty, and by the time I'm confident that we will be in a position to accommodate you, few of you to come out as a subspecialist. So with these words, so try to learn at least one important thing in one day. You look back on the day, what I have learned in that particular day, in terms of knowledge, in terms of skill. If you can prove yourself that I have done something, I have done a justice, I have learned one important aspect of your selected domain, I have upskilled my activity at least one in one particular day. You look back, nobody actually there to criticize you, nobody there to police you and all. You are the masters of your learning activity. With these words, I will just enter into my official responsibility. As I told you, this is too technical to invite our own faculty members, our own chairman, and our own senior stakeholders here. Just to fulfill my responsibility, sir, we wholeheartedly welcome here because your vision, passion, and dedication, the institution has grown to this level. No doubt about it. So continue. We are looking forward to your support in the future also. On behalf of the entire faculty, students, and the staff of SRM Medical College, I wholeheartedly invite you. Your presence is definitely making a significant landmark in their academic journey. So in one word, I invite our Chief Director, Dr. Sethuraman sir, and Director Professor Kartha, our Medical Superintendent, Vice Principals, Dr. Kamala and Dr. Balaji, and our research scientist, senior science who recently joined our Professor Arun sir and Director ma'am, Ravindra ma'am, they are all there. And Suguna, they are all there actually, really a magic blend of different streams. They are actually doing the wonders here. I'm 100% sure. I, on behalf of the entire student and faculty members, I wholeheartedly welcome you to this particular August gathering. It's a momentous occasion for our postgraduate students. And I welcome the most important celebrities of the day, the first year postgraduate students. I hope you are having a wonderful stay in the academic scenario also. You will be having a very, very fruitful days to remember forever. And you will be carrying and you will be branded as ambassadors of TSRMMCH&RC College once you go out and start your career. I wish you all the best and very prosperous, rosy path ahead of you as the specialist of your stream. I wish all them great success, and I welcome all the senior professors who are actually going to guiding as a guiding force for you. And your presence is also a very remarkable and definitely well accepted, and it's actually an added flavor to this particular function. I wish you all the best, and thanks a lot for arranging such a wonderful induction program. Hope we will be doing an extremely good job ahead. Thank you. Jai Hind.
Thank you, sir. We will now proceed with the traditional lighting of the lamp. I request all the dignitaries to come forward for this auspicious moment. Thank you, dignitaries. It is our greatest privilege to invite a visionary leader and the driving force behind the success and growth of our institution. We would now like to invite our Honorable Chairman, Sir, Dr. Shivakumar, Sir, SRM Group of Institutions, Ramapuram, Chennai and Trichy, to deliver the presidential address.
Good morning to one and all on the stage and off the stage. Dear students, it gives me an immense pleasure. This is the first of its kind, this program I'm attending. And I should thank the administrators for it. Right. Let me make my speech sweet, small, too many. There are so many people here, and therefore you will get the same answer. I'm sure you all want to lead a successful life and a successful profession. I'm sure you don't have any doubt on that. You all want to lead a successful profession. Money should be a byproduct. If you focus on money, then naturally you will see a fall in your profession. So basically you should focus on how to establish and make your profession successful. I feel a bit tired, my sugar went down to 63, just recovering. So, I'm a bit tired. I'll try to, without any interruption, I'll try to complete my speech. Now, to make your profession successful, basically you need good knowledge, good skill, soft skills, which normally being taught in the engineering, technology institutions, technical institutions, and not much focused in medical colleges. Knowledge shouldn't be a problem. You have good professors, you have good institution, you have all facilities. As he mentioned, you have a lot of clinical materials, and there I want to mention one thing. We have achieved in academic and a lot more in clinical side. So that responsibility is with my doctors. So you can acquire knowledge. As sir said, it's an active learning. It is not a school. It is an higher education. You have to put the effort to acquire the knowledge. You have to spend more time on learning, understanding. That's one part, knowledge. Second, application of the knowledge is the skill. But without the skill, only with the knowledge, you cannot do anything. You get confidence only when you have good skill. I can do, another முடியும் அப்படின்னா தான் உங்களுக்கு அந்த confidence வரும். I can cook. There are surgeons who don't take up emergency surgeries. They only prefer elective surgeries because they don't have confidence in handling emergency. There are doctors, I don't want to mention surgeons. There are doctors, they don't want to handle any cases which may land in complication. That's a routine expected in any treatment or in the process of the disease. Patient may land in, but they like to be on the safe side. They don't have the confidence in handling. Only when you handle these critical cases, your name will get established. You will handle it only when you have confidence. You have confidence, you should have good knowledge and skill. Okay? Hope you will understand this basic. Not like any profession. You have good knowledge and skill, you will have confidence and you will be successful. Knowledge, right? Skill. That I want you to focus more. Okay? You have to get trained in the clinical side, hospital. You have to spend more time at the hospital. Why I am mentioning it? Frequently I am saying doctors are not there in the ward. PGs are not in the ward. I don't know how you will gain skill. And as Dean said, these 3 years are very crucial and important. After that, you won't have time to read or even to get trained anywhere. Directly you will be handling the patients in your clinic, in your hospital, and each case is going to be an example. Each case is an exam in a clinic. No one will be there with you. You alone will be handling the patient. It's an exam. Correct? I was being a chairman at the last week. I studied in Stanley. I worked in government primary health center. Government service I was there in 4 years. For 4 years. Daily I used to see around 120 to 140 patients alone, without any facilities. Rural area. No one will be there to help. You can see all sorts of patients. Okay, go to medical medicine, okay, surgery, okay, you have to handle it. You have to handle it. Those who are working in primary health centers, senior doctors, you will know. I don't know how many of you will get the experience. And confidence in the so many patients standing in the queue. You repeatedly you do something, then automatically with knowledge your skill develops and you get the confidence. That's it. Even if you have to refer a patient, you should know what problem the patient has and you should convey in a polite way so that the patient gets convinced. So this is a complex learn. This 3 years is very important. Don't waste your time in your quarters or somewhere. Spend more time in the hospital. Feel free to go wrong. I don't know, don't confine to your what, keep going around. And when I was doing final year, even during internship, if I come to know that there's a cases there in that particular ward, that is not in my unit, you should go there. It's an opportunity. You won't get this there afterwards. Work on the senior people are there, ask them. So this is a learning period. Don't waste your time. Number 2 is, and another one, OP. Feel free to admit the patients, whomever you see. Don't. So I'm sure the assistants and professors will permit the PGs to give the freedom to admit the cases. Just keep encouraging them. In Stanley, as an house surgeon, I used to admit cases in my unit. My assistants used to support me, and in case if it's not a right case to be admitted, maybe the next day they will dispatch. So I want the senior faculty members to give that freedom to the postgraduates to admit cases, whatever cases they are seeing in the OP, give the freedom to admit, treat, and do the follow-up. I think that will give you more opportunity for you to learn more, right? So this I've been discussing with your dean and MS to create that culture, which is there in many other institutions. Here, few departments are allowing that. Maybe I wish it happens in all the departments. Number 2 is we are going for NATH. Hope you all are aware of NATH. Which evaluates the quality, the certification evaluates the quality of the services we provide in various areas, and these qualities are all well defined. That's all the process. How a particular thing has to be done. It's a process. If you get involved in the NABH accreditation process now itself in your department, you can avoid a lot of legal issues, legal complications, problem with the patients in future. You will know how to do things in a systematic way. So again an opportunity here. You can learn something about the quality side also. You can give a quality service, which is need of the hour. Every day we are seeing in the newspaper, problem patients are creating problem. And even here, that often we are getting notices from the patients, and since we maintain all the records and all the other things properly, we are able to convince, manage, and we handle them. So it's an opportunity for you to learn that area also in education. And third one is a new topic. Recently we are insisting and we are talking this research. Usually doctors are hours on that. They don't want to get into research. Now things are all changing. So it has become a part of your academic activities, I can say. Our dental college in Chennai is not a dental college, it's actually a dental research institute. To that extent, research is going on there. First year, BDS students are involved in the research. So when you get into research, your way you think itself it will change. When you come across a problem, you will know how to handle it. your mind, the way it thinks, it gets improved, and it's something different once you get into research. Okay, what is the benefit? A lot of products are coming out of our dental college. 3D printing technology, first time for dentists, it has been invented in our dental college now. They are applying for patent and they are going for manufacturing also. You can become an entrepreneur. A lot of instruments, medical instruments which you are using, it's invented by a technologist. Same, a medical professional can join and they can do it. A lot of researches are happening, and our research director will tell you what way it will be helpful for you and how you can get involved. Now, already you are into research. Your dissertation itself is a minor research work. So you can do it in a bigger way. That's a minor project, or in a bigger way they call it as research. Third one is, you can see 3 successful administrators. Fourth one here, right? They are all medical professionals, but they have become a successful administrators now. That option is available for you. College has completed MBA from Betspilani. And the way he communicates with me, the report he sends me, professional or doctor under my the way he handles an issue. And again, you have a cardiac anesthetist as MS, an administrator. Doctor in hospital administration are different or another. So we are in need of administrators from Open Medical College. Our dean. He talks more about research, startup, innovation, a new language. It's an opportunity for you to come out of your routine or medical college doctor. Now everything has changed. And the newer, younger generation are exposed to a totally different ecosystem. And we older people were trained in a different ecosystem. This is the complex. You all want to do something innovative, and people sitting on the top like me, we don't know what you are telling, so we won't agree. Because we were in a different period, and you are in a different period. Your ecosystem, everything has changed. We want you to become an entrepreneur, we want you to become an administrator, you are an industrialist, and you are invent pannalandrom. Idella nam English la yarum sollala. But by default we all became administrators. Without training we became administrators, and we need lot of administrators. Example paranga, cardiac anesthetist is sitting here. Likewise, we need lot of quality people in hospitals. Other than NABH. We have highly qualified medical professionals in quality. What all I'm telling you, they are all highly paid. Other than don't think they are all the alternate for medical success. This is better than, in many situations, this is better than the routine practice. These opportunities are available. Research in Ademar, opportunities. So you are going to be here for 3 years. So just explore. There is no hard and fast rule, no compulsion. These are all available here, and all the experts are here. Feel free to interact. And again, I am sure our senior professors will give you full support for all betterment required for you. We will provide, and they will give you the full support. Right. So I thank all the teaching faculty, or senior doctors and other supporting staff for running this program successfully. We have gone up from 15 to 106 now, as Sir wish will be scaling up high, and a lot more to do here. We have a lot of plan, and maybe as and when required, we'll have interaction with you and we'll involve you in all those activities. Thank you. All the best.
Thank you, sir. Your insights and expertise made a significant impact on us. With utmost respect, we now invite Professor Dr. Sethuraman, sir, Chief Director, SRM Group of Institutions, Ramapuram, Chennai and Trichy, to share his insights.
Very good afternoon to everybody present here. Our chairman, only through myself and research director, we don't directly belong to medical profession. But at the same time, we are participating in order to wish you all a success. You have chosen this TSRMMCH&RC Medical College on seeing the website through word of mouth from your seniors and other faculty members you have joined. Luckily, we have our beloved chairman who belongs to medical profession. He knows your problem. He will be able to appreciate. Only thing is, as long as you are here, you should always keep it in mind. This college is located in a rural atmosphere. In these 3 years, while learning, you can do a good service to the public, namely patients. Your service will be remembered by these village people, these patients coming from in and around this area. That will be remembered forever in their life. You may get your certificate, MS or MD, but that appreciation, that will give you satisfaction, that will help you when you go out of this college to start your profession. I wish you all a 3-year fruitful and successful years in this campus. Thank you.
Thank you, sir. I now invite our beloved director, ma'am, Dr. Revati, ma'am, to share her words of wisdom.
Good afternoon to one and all. Our beloved chairman, sir, CD, sir, our dean, sir, MS, sir, and all our administrators, and all our senior professors. We are really happy to have touched the magic figure of 100. We have 106 PGs. It was really a very dream for us, and we have gone for increase in seat for this year also, and we are very sure, sir, we will achieve that also. And I just want to tell one word to the PGs. You have very good faculties, which you don't have in many of the private colleges. All are fully equipped, fully trained, who can train you well. You are becoming masters of your subject. You are going out as consultants or as teachers. So you will be well trained here, I assure you, and you must be the master of your subjects, whatever it may be. SRM இருந்து ஒரு பிஜி வெளியே போனா அவங்க சப்ஜெக்ட்ல அவங்களுக்கு you must be the authority. அந்த அளவுக்கு you must be trained. Please take, as Sir has already told, please try to spend your time in the wards. Each patient is a book for you. Each எந்த வார்டுல இருந்தாலும் எந்த யூனிட்ல இருந்தாலும் எல்லா ஸ்டூடெண்ட்ஸும் they belong, எல்லா பேஷண்ட்ஸும் they belong to you. எல்லா கேஸையும் நீங்க எல்லாரும் பார்க்கணும். நீங்க வெளியில போய் SRM ஓட பேரை கொடி கட்டி பறக்க விடணும். That's what we want. Please, thank you.
Thank you, ma'am. We extend a very warm welcome to our medical superintendent, Dr. Edukonduru, sir, to share his insights.
our beloved Chairman Sir, Dr. Shivakumar, Shri Sir and P Sir, respected dignitaries, welcome our postgraduates. I feel very enthusiastic and proud to be among you as an younger generation. You shine. The few things that you have to take an advisory as an youngster is to identify that learning is a continuous process, and that too for a doctor it never ends. Till last day of the breath, the learning is a continuous process, and there is no limitation for it, particularly in the medical field. And one more thing is that this 3 years of period is most important period for you, unique period in such a way that this is the place, this is the time period where you will have a best hand holding. At the same time, you can innovate, research, and push your boundaries to learn. And this unique time you will never get back. So, use these 3 years of period as best part of your life and best to innovate and learn. Having said that, take home 4 points always in your life as a specialist. That is, for any doctor or for any person for that matter, to be successful in life, availability, empathizing, active listening, availability, empathizing, active listening, and willing to learn is the 4 characters that makes anyone to be successful. It is not the money, it is not the influence, it is not the infrastructure, it is none else but our own attitude that matters to improve upon ourselves. So I wish every one of you will learn equally by expert wise with the available faculty who is best chosen among all over India. So I don't think that you will differ in your skills and expertise wise, but we all differ by these attitudes. So as much as possible, as far as possible, if you are able to cultivate these 4 habits of active listening, empathizing, and availability, and willing to learn always, will make you more successful than other things. The most unique nature in this institute is, let me tell you, our chairman sir, who is himself a doctor and who is unique by nature, he is very approachable, very easily, more than anyone. He is more approachable, more listening of nature, more committed towards us, and the infrastructure is so wonderful, and the available resources are so wonderful. You have to absorb it. It's all yours. So such a unique place is this for you to learn. Thank you.
Thank you, sir. We are honored to welcome Dr. Karthik, sir, Additional Medical Superintendent and Head of Department of General Surgery, to share a few words with us.
Respected Honorable Chairman, sir, Chief Director, Dean, sir, and all the dignitaries on the dais and all the HODs. My dear postgraduates, all kindly utilize the resources which has been available, and my best wishes to you all. Thank you.
Thank you, sir. We would now like to invite Dr. Balaji, sir, Vice Principal, Administration, and Head of Department of Biochemistry, to address the event.
Respected dignitaries on the dais, my dear colleagues, and dear first year postgraduate students. A very good morning to one and all gathered here. See, from the moment that we are born, no matter how much we strive, there is no way for us to escape from learning. Learning is going to be a continuous process. Even if you try or not, your mind is going to learn. See, even the stop clock will show the right time twice a day, right? Same way, our mind also is, designed in such a way that whichever environment we are put, we are going to learn something or the other. If you are put in a passive environment, your mind will learn how to be lazy, how to be passive there. If you are put in an active environment, your mind is going to learn from whatever you are exposed to. Right here you have the display of what environment you are going to be in. You are going to be in an environment, like Chairman sir told, which is going to have a mixture of administrators, researchers, academicians, clinicians, who are of the highest category. And when you are in this environment, there is no other way for you but to learn, and to learn from the best. You have 1,095 opportunities here. 1,095 opportunities. 3 years, 3 into 365, you have 1,095 opportunities. You decide to learn one thing a day, you will learn 1,000 things by the time you finish your post-graduation. You decide to learn 2 things, it's multiplied by 2. You decide to learn 4 things a day, by the time you finish your post-graduation, you will truly be masters of your craft. Right? So the task is very simple. Decide to learn actively, like MSR told, decide to learn actively. Once you decide that, there is nothing else in this world that can stop you from doing that. So with that, best wishes and congratulations to all of you. Thank you so much.
Thank you, sir. We would now like to invite Dr. Karthikeyan, sir, Director Research, SRM Group of Institutions, Trichy and Ramapuram Campus, to share a few words.
Dignitaries on the dais and my dear students, good afternoon. As Shri rightly said, we both are out here. We are from core engineering field, but for the past 4 years, I've been actively working on many of the medical use cases. Last year, we have addressed some of your medical students on the UG students. UG students on AI and healthcare. How AI is going to revolutionize healthcare. Last month in April, there was a study in Nature survey. Most of us know about Nature surveys. In that, India was rated 27th in technology penetration in medical field. Countries like Indonesia, Ukraine is worse. So this is the gap which we are trying to fill in from the research department. In medical college, we are working with several several companies, several MNCs where we are involving doctors, PG students, undergrads, alongside our research team from students from engineering and technology. We are co-creating a ecosystem on different verticals. We are now starting with two verticals. One is radiology, the other one is pathology. In radiology, the company name is Multicolor, correct? Multicolor. It's a US-based MNC where we are creating AI infrastructure to analyze images, MRI images, and to interpret what a doctor, an experienced doctor can understand by seeing an MRI image. That we are going to interpret from the AI system. We are going to assist the doctors in early diagnosis, predictive diagnosis. Yesterday, we are working very closely with most of the medical services companies. Yesterday, our team was in Cognizant. We worked with Cognizant, and there was a team from AstraZeneca. John Hopkins University doctors, alongside the drug discovery team of AstraZeneca, we were having a meeting. It is on human genetic. Just now I was discussing with Dr. Sorry if my terms are little awkward because I'm not a medical professional. It's glioblastoma mutations. That's what we are trying to work on. We have collected, there is some free server called IBM Watson, promoted by John Hopkins University, exclusively for medical data. We are trying to, we have already initiated the process of accessing that. By June, July, we'll be getting the access. So there are 200 billion oncology data alone in IBM Watson. So what we are trying to do is we are getting those data. We are going to create an AI ecosystem which can study the tumor genetic mutations, that is the glioblastoma mutations, and we are going to have a deep research on drug discovery. This is a brief use case which I am discussing, but there are several use cases, like several projects, industry-sponsored projects, and the multi-coder project, the 3 doctors from the PG will be absorbed by it. They are going to be inducted as medical experts, technical medical experts into their core research team. So this is the agreement. We are going to soon sign an agreement. We have discussed with Dean sir. We are expecting the team. The team is in US, so we are expecting them to address the students, select them, and then these students from the PG departments are going to work directly under the supervision of doctors from our medical college and doctors from Multicolor. This is how the structure is, and we are an interdisciplinary campus. As Chairman rightly said, in dental college, we are developing a 3D printer. Students from Ishwar Engineering College, students from our Ramapuram Deemed University campus, and dental students, alongside dental doctors. We are developing a 3D printer that has already been developed. The actual cost of that 3D printer is 87 lakhs. We are producing the same 3D printer for close to 12.3 lakhs. Indigenous inside India, under the Make in India also. We are promoting a startup under that. Same way, our team, again, a core research team from medical college here, then Ishwar Engineering College, then dental college have developed something called as bioglass implant for bone replacements. The moment this bioglass is implanted as a replacement for titanium implants, it can soon calcify and it will be converted as bone. This is patented again. This is again research, a joint research, interdisciplinary. So what anyway I will be addressing you separately on the AI and the other use cases what we are doing. So what we request from the PG students is research is no more medical. There is nothing like engineering, like I said. It is all interdisciplinary. Being an interdisciplinary campus, we have all the facilities here. We are the strongest biotechnology department in IST, Institute of Science and Technology, Trichy campus. We have very strong core AI group in both campuses, both Ramapuram as well as Trichy campus. So it is all about how we are going to utilize these facilities. That's why we will be having a separate session on the interdisciplinary research. All the best. Thank you all. So I will be available on Thursdays and Fridays in Trichy campus. Dr. Sugna is always contacting, in touch with us regarding the research programs. You can always meet us through Dr. Sugna, Dr. Balaji, Dr. Kamala. They're all working with us. Now these are closely contacting us nearly once a week. We are talking. So, anyways, I'll be sitting in fourth floor, or if you want a discussion with us, or my research team, we are always happy to walk into your floor and discuss. Thank you.
Thank you, sir. I would now like to invite Dr. A.M. Dharmarajan, sir.
So, I can give my mobile number directly. Anyway, most of the faculty members are. It is 938. Can I? 938 221 2233. And my name is Kartha. 938 221 2233. So you can WhatsApp me, call me if you have any ideas to take it forward. We are always open. Thank you.
Thank you, sir. I would now like to invite Dr. A.M. Dharmarajan, sir, Professor Emeritus Research, to share his insights.
So good afternoon. At the outset, I would like to thank the chairman and also the dignitaries on the stage and off the stage for having me here. It's really a pleasure to be here. In fact, Dean said he has been here for 3 months. In fact, I've been here for 3 weeks. So just 3 weeks passed, and I'm really enjoying it. And I'm sure the new students who join for MD, you will enjoy as much as I'm enjoying. It's when you join, first of all, I would say you made the right choice. As the Dean said, this is one of the pillars of higher institutions that I know of. SRM is really well known not only for medicine but also engineering, as the Director of Research said. There's a lot going on, which I've seen or witnessed in just the last 3 weeks. So you have to believe me, there's a lot going on. And talking about the interdisciplinary research, I mean, that's really important. We've got a campus with full of knowledge and all the facilities. I took a tour of the IST, the Institute of Science and Technology. Again, as Sir said, the Department of Biotechnology, I would say, is very well equipped, and they've got state-of-the-art equipments. And I'm sure we should be able to make use of it and do excellent project. So the newcomers, I'm not going to call you freshers because you're not freshers anymore. I think you joined in December, so about 5 months have gone. You are really veterans, definitely more veteran than me. And you are joined with a lot of excitements and also a lot of feelings and fear, and you don't know what you're going to get into, even though you're done your MBBS, things you don't know what it's going to be here at SRM. And I'm sure now you're at ease, since 5 months have gone. And I would say for sure that you'll be on a roller coaster from now onwards. They'll be full of excitements, and also the achievements, and also the ultimate success. So that's what I'm sure you are here. And you learn a lot, and at the end of the day, SRM not only going to produce a good postgraduate student by the MD or MS. So what I'd like to say is you should turn out to be a good human being. And the sir mentioned about Vivekananda. What he was telling is more than what you achieve or what you discover. When you leave the place, you've got to be a very good human being. And that's your profession, right? All of us, we are supposed to help, we are supposed to save lives. And also, so like you pointed out, it's not the money. Money is one thing, but of course, being a very good human being is extremely important. And I'm sure the SRM in 3 years will do that. And also, we have got excellent faculties, and when you leave, you will be definitely carrying the flag, the SRM flag, very high, because the training that you are going to receive from us is going to be really truly phenomenal. It's going to be truly outstanding. And going back to research, again, the multidisciplinary and also interdisciplinary research, just feel free to approach any of the faculties. You know, we've got all the faculties who've got experience, and also involved in research like myself. We are more than welcome to approach me or want to talk to me about your project, I'll be more than happy to help you and come up with some ideas. So with that, I'd like to thank you for having me, and also I'd like to wish you all the best in your 3-year career, whatever you do, MD or MS, and just enjoy. And before I finish, I just want you to, not only the education is one thing, just explore. So I'm trying to explore that, but I still haven't done it yet properly. It's a beautiful campus, and just walk around, enjoy the nature, and I find it so green. I came from Ramachandra is also green, but this is a really nice campus. It's really beautiful, and it's so big, and just take a walk and enjoy. Just put the education to one side and just enjoy the nature. With that, I'd like to wish you all the best and good luck with your program. Thank you for having me. Thank you, sir.
Thank you, sir. We would now like to invite Dr. Sethuraman, Professor of Community Medicine and Research Coordinator of our institution.
Sorry for the interruption. I know I'm in between the program. Due to pressing duties, our chairman will be leaving us, but the program will keep continuing. Thank you, sir.
A very good afternoon to the respected dignitaries and my dear postgraduates. I feel really honored and humbled to address in front of all these stalwarts. So, whatever these stalwarts have told so far, I'll put it in a nutshell. You being in SRM, S stands for Service and R Research, M Medical Education. So, ultimately, you'll be facing the patients and you'll learn a lot from our patients. And research in the middle is going to be the core, and medical education, you are going to learn a lot from your teachers and you are going to learn how to teach your students in future. So already the ICMR call for has opened, and I have addressed you for submitting your thesis for ICMR thesis support. But please do not stop with ICMR. As I told you before, please do apply for all the DST and DPT projects. And now our Tamil Nadu Health Department has given a lot of opportunities and funding opportunities for the postgraduates and even undergraduate students. Please approach us and we are here to help you. Please, my kind request, if you can directly call me also, we will come to your department and help you in preparing the draft and submit the proposals. So all the best for your all the three, service, research and medical education over here. Thank you and all the best.
Thank you, ma'am. We would now like to invite Dr. Niranjan sir, Head of Department of Anatomy, to share a few words.
Good afternoon, dear students. From the Department of Anatomy, I would like to congratulate you and wish you for your best future. And from our department, if you need any help academically and research-wise, you are always welcome. Thank you all.
Thank you, sir. We would now like to invite Dr. Shivakumar, sir, Head of Department of Physiology, to share a few words.
Good afternoon, everyone. So first thing, I will congratulate all the postgraduate students for getting seats in the SRM Medical College. One thing which everybody already told about the academics and your role, what to do. Only one thing I will tell is acceptance in life is very important. So whatever you do professionally or in your personal life, so try to understand the situation and accept whatever comes to your way. And I wish you all the best. Thank you.
Thank you, sir. We would now like to invite Dr. Ashokan, sir, Head of Department of Pharmacology, to share a few words.
Good morning to all of you. Best wishes for the PG students. First thing you should know how to learn, how to give the services as Madam told. you should have compassion and curiosity, dedication. All the 3 years. If you follow this, definitely you will be a successful doctor. You will not face any legal problem. You know, we are all coming with so many legal issues. So have compassion, have curiosity, have dedication in doing the service. Thank you for the opportunity given.
Thank you, sir. We would now like to invite Dr. Chitra Rajalakshmi ma'am, Head of Department of Microbiology, to share a few words.
Very good afternoon to one and all here, especially the postgraduate students. You have taken your intellectual journey, so grab the opportunity in SRM to learn, to grow, and to shape your future. All the best.
Thank you, ma'am. We would now like to invite Dr. Hemalata ma'am, Head of Department of Community Medicine, to share a few words.
Good afternoon, everyone. My heartfelt congratulations to all the postgraduates who have joined in our institution. So we have excellent academic, research, and clinical opportunities that are available for you. So utilize every opportunity that is available every day. Don't miss out any of the opportunities so that you will excel in your field. Have a successful year ahead. Thank you.
Thank you, ma'am. We would now like to invite Dr. Shivakumar sir, Head of Department of General Medicine, to share a few words.
Good afternoon to one and all. Dignitaries on the dais and off the dais are my dear students. And my heartfelt congratulations to each one of you for securing a postgraduate seat. Thank you very much for selecting our college. Seriously, it shows how much trust you have in us, isn't it? Strongly, seriously, you will not be disappointed. Seriously, you will not be disappointed. It's a wonderful college. No matter. Actually, you have started a new journey, isn't it? New journey. But this journey demands more commitment. We have countless hours you have dedicated for another 3 years to learn and new skills, new knowledge, everything. So I wish you everyone just focus on it. I will be asking only one question for all the postgraduates. For whom are you all learning here? Can anyone say? For whom are you are learning? For whom? For you? For your parent? For whom? For your patients, isn't it? Yes. I strongly believe in that. So patients smile is your success. Patients smile is your award. Patients happiness is your real success, not other things. So just work for the patients, read for the patient, learn for the patient, take pain for the patients. Everything is for patient, not for you and not for your parents, only for patients. Thank you very much. I wish you everybody have a very good day. Thank you.
Thank you, sir. We would now like to invite Dr. Beljan Premkumar sir, HOD in charge, Department of Pediatrics, to share a few words.
Good afternoon, everyone. So I just want to respect the dignitaries on the dais and off the dais. I just want to specify you only one point actually. So it is disappearing nowadays, no? So all people know, everyone talked about a lot of things. So I want to tell you is always spend more time in hospital, more time in the wards, and finally more time with the patients. So the reason began spending more time with the patient is the important art we are losing nowadays actually in the recent generations. Taking a proper history actually. The art of taking a history is very, very important. So a beautiful history with good examination will tell you what are investigations with relevant investigations and specific treatment. That will make you a good clinician definitely. So all the best for next 3 years. Welcome to Trichy family. Thank you on behalf of Department of Pediatrics.
Thank you, sir. We would now like to invite Dr. Shivakumar, sir, Head of Department of Psychiatry, to share a few words.
Respected administrators, thanks for the opportunity. Dear students, my best wishes for your career. I would like to say 3 abilities if you could be able to develop or acquire, it will be very successful journey for you. One is availability, number 2 is accessibility, number 3 is responsibility. So be available at your workplace, that is very important. Number 2, be accessible whenever it is required from your patients, teachers, students, whenever, wherever required. And be responsible at your workplace, that is very important. Responsibility here, I would like to say, it's not that you have come here to see how we are treating the patient. It should not be in that way. You have come here to see your own patient. This is your hospital. The patients are your patients. You should take that responsibility. We are here to guide you how to treat that patients. It's not that you are here to see how we are treating the patient. So that responsibility, I think, you should take. That is one thing. To develop day by day. உங்களுக்கு ஏற்கனவே தெரிஞ்ச விஷயத்தை வந்து பிராக்டிஸ் பண்ணாம இருக்காதீங்க. தட் இஸ் வெரி இம்பார்ட்டன்ட். எல்லாமே எல்லாத்துக்கும் தெரிஞ்சிருக்காது, வாய்ப்பே இல்லை. பட் ஏற்கனவே தெரிஞ்ச விஷயத்த பிராக்டிஸ் பண்ணாம இருக்காதீங்க. எது தெரியலன்னு உங்களுக்கு தெரியுதோ அது தெரிஞ்சுக்கிறதுக்கான முயற்சி பண்ணாம இருக்காதீங்க. இந்த 2 விஷயத்த பண்ணீங்கன்னாலே டே பை டே வந்து யூ வில் பி ஏபிள் டு க்ரோ. தேங்க் யூ ஃபார் தி ஆப்பர்ச்சுனிட்டி.
Thank you, sir. We would now like to invite Dr. Ranganathan, sir, Head of Department of Respiratory Medicine, to share a few words.
A very good afternoon to all. Respected dignitaries on the dais, heads of departments, faculty, dear students, and other staff assembled here. I am happy that I have got an opportunity to speak a few words to the new PGs. Initially, I will congratulate all of you for having secured a seat for post-graduation and for having opted for SRM Medical College. There is enough clinical material in this institution. You should utilize the clinical material, learn so that in the long run, after you pass out, it will be useful to you. So my PGs are there, 2 PGs are there. As soon as they came to the department, I told them, get a landscape notebook from the supermarket. And I told them every day, what are the cases you see, what all you have learned in the department, rounds what all you have seen. You write down in that landscape notebook 1 page, and every day by 3:30 or 4, I am here till 4, even 4:30, you have to show me, you have to get my signature, I'll put the C. So every day, what all you see, what all cases, what all you study, you have to write in that notebook and show it to me. So similarly, you should keep a tab on what you are doing every day. The second thing is timings. Please you should maintain the timings. Timings is actually, it reflects one's commitment to duty. So a person who comes in time, who goes in time, he is committed. So you should maintain your timings. Timings is very important. And secondly, reading is also very important. What I usually say is spend at least 4 hours every day reading. And clinical material, see the cases in the ward, as our administrators have advised, spend more time in the wards. You will learn a lot. And with these few words, I will be winding up and give you my best wishes so that you will pass the exams, come out with flying colors. You will be useful to the community, and what you have learned here will definitely benefit you in the long run. Thank you very much.
Thank you, sir. We would now like to invite Dr. Akila, HOD in charge, Department of Dermatology, to share a few words.
Good morning to everyone. I thank
everyone's giving me this opportunity. I welcome our young, energetic, enthusiastic postgraduates to SRM. Congratulations in joining this institute. I hope you are well received and well taken care of. So make use of this institution. In my personal experience after my post-graduation, I see a variety of cases in SRM compared to my previous institution, day in and day out. So make use of all the clinical material you have and all your teachers. Congratulations.
Thank you, ma'am. We would now like to invite Dr. Sethuraman, sir, Head of Department of Radio Diagnosis, to share a few words.
Good afternoon, one all. First of all, thank you to the administrator. Welcome to postgraduate student 25 batch. This is 2025 batch, and this is 5th batch of postgraduate student in SRM Medical College. I tell you what important is the 3 important points. One is knowledge and skill and confidence. This is very important. One more thing is, all postgraduate students, we discussed, suppose you are our PGs, you go clinical, discuss with other department, medicine and surgery PGs. If you have any doubt, anything, please come and discuss with the radio diagnosis. I give more confidence and give support. Once again, and all the best and congratulations. Thank you.
Thank you, sir. We would now like to invite Dr. Sethuraman, ma'am, Head of Department of Obstetrics and Gynecology, to share a few words.
Hello. I'm very happy with the set of PGs that we have. My girls are extremely hardworking, extremely dedicated. So, yes, I'm extremely happy. What I want to tell you is simple. Take care of your health, because if you're not physically strong, you won't be able to work. You need to learn to adjust your environment. Things will not always go your way. Life is not fair. So learn to adjust with your peers, with your teachers. And if you have issues, please come to us. Don't go to the breaking point, and you're all over the place. So please come to us if you're extremely stressed. We will help you out. And learning is a continuous process. Your target should not be your final year exams. Your target should be above and beyond. So learn about yourself and decide where you're going to be at the end of 3 years and take steps towards that. So I welcome my babies to my department. Extremely happy to have you with us. Thank you.
Thank you, ma'am. We would now like to invite Dr. Ramesh Vairavan, sir, Head of Department of Orthopedics, to share a few words.
Good morning, everyone. Respected dignitaries on the dais, my HODs, and my students. I first of all welcome all the new postgraduates and congratulate you for selecting SRM as an institute. As already mentioned, learning is a continuous process. Don't stop learning. And part of that learning is don't hesitate to teach. And also don't hesitate to ask. With these few words, I welcome you all once again. Thank you.
Thank you, sir. We would now like to invite Dr. Gandhi, sir, Head of Department of Otorhinolaryngology, to share a few words.
Good afternoon. Hearty congratulations to all the postgraduates who have made it to SRM Medical College. I want to stress just 2 points which have already been touched upon by previous speakers. One thing, please try to stay in touch with the rare art of examining the patient physically and taking history. And then 2, you have only 3 into 365 days of course in this college. That's all you have to acquire knowledge in your chosen specialty. So with a sense of urgency, grab all the opportunities to learn. And my sincere thanks to the administration and the organizers of the event for offering me this chance.
And once again, good wishes to all the newcomers.
Thank you, sir. We would now like to invite Dr. Inago, Head of Department of Ophthalmology, to share a few words.
Respected Dean, dignitaries on that is professors and my dear students. At the outset, I would like to welcome you all to the SRM. I think the decision you have made is definitely correct, and you have a lot of clinical material, so you will not miss on that. Few points I would like to mention on about the type of dissertations or thesis, that is on the quality of the thesis we see in the present set of postgraduates these days. Mostly these topics are copied from somewhere else, and I just signed up for a AA in research. This is a 2-day course that is going on in the college, and it's unfortunate to see out of the 100 postgraduates, hardly some 10% has signed up this, because it's very important at this point of time. You learn how to develop a research topic, and then the last few sessions we attended, it is not just ChatGPT. It's there are a lot of other tools where you can work up, selecting the topics, how do you write the objective, how do you do a literature research. All these things can be made use with the AI, and it makes your work easier also. Instead of just copying the thesis from some other person's topic, it is better you develop your own research question. Now I would recommend or request our Dean sir and Trichy madam just to make it mandatory for all the postgraduates, because it can be done in batches also, because hardly some 27 people are sitting there. So I wish that all the postgraduates go through this course, because as a participant I definitely find this very helpful. So thank you.
Thank you, sir. We would now like to invite Dr. Kamala ma'am, Vice Principal Academics, to deliver the vote of thanks.
Before I have the great opportunity of delivering the vote of thanks, it is my duty to introduce Dr. Arun Dharmarajan sir to the crowd. So whatever I know, I am telling you. His profile is too big to be told in 2 minutes. So whatever I can, I try to do justice, sir. Professor Arun Dharmarajan was educated at the University of Western Australia, Perth. He spent 10 years at Johns Hopkins School of Medicine, Baltimore, USA. He had several portfolios as Associate Professor, Director of Reproductive Endocrinology, Director of OBGYN Research, etc. He moved back to UWA in 1994 and has spent 10 years at Johns Hopkins, Baltimore. With his extensive medical background, he was appointed as professor in the School of Anatomy, Physiology and Human Biology at the University of Western Australia, Perth. The main focus of Professor Dharmarajan's research is to investigate the role of secreted frisilled protein 4, if I am not wrong, sir, and its interaction with WNT signaling molecules in cancer and specifically cancer stem cells. These studies, done in collaboration with Professor Sudha Warrior, the current principal of FBMST Shri, Chennai, is happening since 2011. This protein was discovered by Professor Dharmarajan in collaboration with the late Professor Bob Frills, University of Bern, Switzerland in the early 90s. He is on the editorial board of several international journals. More recently, he has been invited to serve in the editorial board of British Journal of Cancer, which he considers most privilege and honor. Professor Dharmarajan has published more than 224 research articles, 205 PubMed, and supervised more than 120 honors, MSc and PhD and postdoctoral research fellows. His H index is 53. He is also the guest editor of several high-impact journals, including Cancers. Professor Dharmarajan has been invited to speak at more than 150 national and international conferences, and he is the reviewer of more than 75 international journals. this kind of introduction runs for 10 pages. Obviously, we do not have the time, but he is at our disposal and it is for us to use him. He's got very close, he's worked very close with many of the Nobel laureates, and under the guidance of our Dean sir, we are trying to bring one of the Nobel laureates who has discovered H. pylori to the and he was awarded Nobel for that. So please, it is up to us to make use of Professor Dr. Dharmarajan. He is seated at the old vice principal room next to Dean sir's room. His doors are always open to anybody who is interested in research, both from the faculty and from the postgraduate side. Sir, thank you, sir. Good afternoon, everyone. It is my privilege and honor to deliver the vote of thanks on this momentous occasion, this inauguration of the 2024 batch of postgraduate students at Trichy Medical College Hospital and Research Center. First and foremost, I extend my heartfelt gratitude to our esteemed chairman, Dr. Shivakumar sir, Mr. Niranjan sir in his absence here, our co-chairman, the Chief Director, Professor Dr. N. Sethuraman sir, for gracing this event with their visionary words and unwavering support. A sincere thanks to our respected Dean, Dr. Gopakumaran Kartha sir, Director, Dr. Revati ma'am, Medical Superintendent, Dr. Yedukundalu sir, Additional Medical Superintendent, Dr. Karthik sir, and our Vice Principal Administration, Dr. Balaji sir, for their inspiring guidance and leadership. We are truly grateful to all the heads of the departments and faculty members who have joined us today. Your presence and blessings meant a great deal to our new PG students. To the organizing team and support staff who stood by me in organizing this program, thank you for the smooth coordination of today's event, especially my dear undergraduate students who at the last minute, they were given only one day to prepare for this program, and I'm sure that they did a wonderful job. And finally, a warm note of appreciation to our enthusiastic new postgraduate students. May your journey here be filled with growth, purpose, and excellence. Thank you. Now I request all the postgraduates to join the dignitaries for a picture. Thank you.